Because the government is privatising the NHS, and they don't want to tell you they're privatising the NHS, in his post-election speech, that one on a seven-day NHS, 18th of May, first Cameron post-election speech, he didn't talk about the NHS before the election, but he did afterwards. He said, I'm not privatising the NHS any more than Mr. Brown and Mr. Blair. So they try and hide it. They still pretend they are not privatising the NHS. And to discover any information, you have to go and burrow through Google and spend hours deciphering what they're on about. And then they obfuscate so that you can't find out. So we're up against a government machine. And I have to say, with the economic crisis, it's a very desperate government machine, and they're moving very quickly. And they are determined to get this thing privatised as quick as possible, which is why they've laid down the gauntlet to the junior doctors, the consultants, the GPs, and actually the whole of the NHS staff with these new contracts. They want to smash their contracts, create a cheap workforce, and then hand it over to big business, their friends, who are circling round. You know, after all, where does Simon Stevens come from? He came from United Health, didn't he? He was the head of the global director of health for 9 years in the US. And they headhunted him and brought him back, put him in charge. And that's what this is. This is a privatisation plan written in code so that you can't understand it.
When the Health and Social Care Act came in, there was all the sort of fanfare about how we're going to get rid of all the pen pushers and the back office staff, and we're going to focus on the clinical care, when in fact you need people to do all that. All those jobs need to be done. It's ludicrous. In fact, what I've noticed, certainly, and probably Anna the same, is that an awful lot of the people who were made redundant have now been brought back again to do jobs that actually need doing. But NHS England is in absolute disarray, and they've made cuts and cuts and cuts, so they just don't have the staff. If Amazon and Google and whoever, Richard Branson, if they all paid their tax, billions and billions of tax, which should be paid, and there are various other ways. I mean, there are all sorts of ways, aren't there, that the government could choose. They could choose to spend the money on the NHS and public services, and they don't. There's plenty of money in this society to pay for our public services, and that's why we have to carry on fighting and demanding that they do that. We had far more debt after the Second World War, and yet we managed to build the welfare state then. It could be done now.
CCGs are statutory bodies, and they have a remit from the Health and Social Care Act, a mandate to bring in the market. That's what the Health and Social Care Act did. It abolished the public administration of the area of the PCTs, which ran a public service, publicly provided service, and instead that was all swept away, and we've ended up with NHS England, which is a state-appointed, in my view, privatisation board. It has a mandate to bring in the market and tender out the whole of NHS provision to private companies. That is its job. They have been given all the money, and the CCGs have been given 60 billions of the money, and they have the same mandate. They have two mandates, actually. They have to work within budget, they have to ration, and they have to bring in market providers. You tend to find, obviously CCGs vary a bit, that you tend to find that the most entrepreneurial GPs end up on these CCGs. The orders are coming from on high. You know, when they pushed that bill through, the decision was to privatise the NHS. I know Lansley and Cameron and Hunt all say we're not privatising the NHS, but they are privatising the NHS, and that's why they changed the whole reorganised the entire administration, a cost of something £3 to £5 billion they spent on it. So it's an instrument, it's a privatisation board. As I say, you can't vote for them. They're state appointed, and they're carrying out their job. It's not just GP surgeries being closed. 60 DGHs up and down the country being run down and degraded. Yes. I think Haywards Heath is probably losing its acute services. I know Eastbourne has lost general surgery, orthopaedics, consultant-led maternity. It's all about concentrating everything on this Brighton Centre, which is going to be a super hospital and all the rest of it. That's why Matthew Kershaw was moved down here. But the corollary is 70 or so DGHs are being run down and closed down.
The NHS is so complicated. What they're doing, how they're privatising the NHS is so complicated. Unless it happens to something near you, people don't actually realise it's changing until something happens. So with us, our surgeries, and all of a sudden people, oh my God, our surgeries are going. Lewisham Hospital, oh my God, they're going to, you know, close the A&E and make it into a little hospital. All the hospitals Anna talks about. Unless it happens somewhere near you. So people who do understand what's going on just have to get up and make a noise and involve everybody, involve the the MPs, the patients, absolutely everybody, and demand to have a patient participation group in your surgery if you haven't got one, because they're statutorily supposed to have one. So, you know, I think people like us have to jump up and down, and it's time consuming and it requires a lot of energy, but that's how we have to do it, unfortunately.
They want APMS providers to come in because they're on temporary contracts. They're not there for the next 30, 40 years like your GP, and they can then re-tender the practice in future.
And could you just say again what the APMS contracts are?
Well, they're essentially private companies, but they have to re-tender, I think it's every 5 years, so it's a short-term contract that they have. Whereas when you have a GMS provider, the traditional independent contractor provider, he will serve his own life for that community and will often be there 30 or 40 years in a village or town or wherever. And so there'll be continuity of care. There isn't that same continuity with an APMS contract. So, and of course, if they can't make money on it, they can back off and it has to be re-tendered out. But they prefer that because if they're moving over to HMOs, multi-specialty community providers, with these colossal out-of-hospital providers, which will be private companies like Kaiser, then they're quite happy for temporarily to have private APMS contracts.
So when a GP surgery, if all the partners retire or leave or something happens, and I think it sounds like this is what happened to you in when your surgery closed, they had to go to Brighton Station, which I'm assuming is run by some under an alternative provider of medical services contract. Care UK, there you go. So companies like Care UK, in Tower Hamlets we had one run by Atos. They come in, well, yeah, exactly. Yeah, they come in, they run services, they're given contracts for 10 years, and they basically want to run the services on the basis of profit. They will undercut. And what happened in Tower Hamlets, they put in a very low tender. The PCT chose them at the time. And within 3 years, it was clear they couldn't provide the service, and the contract had to be removed from them.
And just to support what I'm saying, there's been a series of articles in Pulse magazine exactly about the South Coast. It says here, NHS England has appointed 21 providers that will step in and take over the running of struggling GP practices at short notice in the south of England. NHS England said its framework will enable primary care commissioners to speed up the procurement of providers to fulfil vacated contracts using APMS contracting and mini competitions if necessary. And then they give you a list of who's on the contract. And who's on the contract? Baines Enhanced Medical Services, Brisdock Healthcare Services, Devon Health Limited, Innovations in Primary Care Limited, Intra Health Limited, Peninsula Community Health, CIC, Virgin Care Services Limited, The Practice PLC, and a whole lot of others. But some of these are private health corporations. That's the direction of travel. So we're all suffering because of our much-loved GP surgeries going to the wall, but they're being pushed to the wall. You have to understand this is a conscious plan. So we're up against the 5-year forward view, long-term plan to privatise the NHS and hand it over to big business. There's armies of managers now on colossal salaries, just enormous, unbelievable. So were the money to go to frontline care, we could probably preserve very much, of our National Health Service. But having said that, it can't be done under the present circumstances because we've got a government committed to handing it over to big business. So that's why I'm openly saying this is a political fight and everyone has to get stuck in and the unions have to take action. The thing about multi-specialty community providers is I'm horrified to say that many GPs don't know that when they're being asked to federate up into these networks, that they're going to end up with this noose around their neck. They don't know the plan. They have not been told they will be working for Kaiser Permanente, and they don't realise. It's horrible. And I think our unions have a responsibility to tell people. As for GP referrals, yes, I'm sure they're incentivised not to. Yes, you can feel it all the time. and they have pressures on them for the CCGs. They watch your referral patterns and they compare GPA with GPD, and they say you're having too many urology referrals or too many colorectal referrals, and it's very, very frightening. Yeah, and of course that's getting GPs prepared for HMOs, because HMOs dictate minimise hospital referrals. That's how they make their money.
We do have pressures on us not to refer, and in some areas they do have referral vetting services, and I hear my GP colleagues from elsewhere. Do you have it here? And
OPTUM.
Pardon?
OPTUM.
OPTUM, right, okay, so the GP, so nothing can go through without OPTUM, can it? And that's just appalling. I mean, it takes, you know, if you go to your GP with your story and your GP makes a clinical decision, shouldn't have to go to anybody. And if your GP isn't sure, that's fine. There's never ever been any studies shown which has shown what is a good referral rate and what's a bad referral rate. There's no such thing. Is referring too many a bad thing? Is referring too few a bad thing? Nobody's ever proved. If there's clinical uncertainty, you should be able to refer to your secondary care colleague. And before the internal market, that was much easier to do, because you could just have a conversation, you could send somebody up to outpatients, it didn't matter. But now it's much more difficult. So what would a good GP service look like? I'm sure most people say they want it to be local. They want to be able to walk there. They want good access. People don't want to wait 3 weeks to see their GP. They want to be able to see their GP. If they're ill on the day, people want to be able to see the GP on the day. There are some things that people can wait for, but you know, people should be able to see their GP in a timely manner. I'm sure nobody would disagree with that. Continuity is important for some people. It's not necessarily important for a young, fit person who's just coming in to get a one-off problem dealt with. But for somebody who's got more complex needs, I think continuity is really important. People don't want to be telling their story over and over and over again. And people want things under one roof. They want a multidisciplinary team involved. They don't want to have to go somewhere else for the nurse, somewhere else for the health visitor, somewhere else for the midwife. People, you know, ideally want it all together, and that's perfectly achievable. There's no reason why that can't happen if the NHS is resourced properly. And I think GPs would be happily provide routine appointments on a Sunday if the government would resource it. But as it is at the moment, GPs can't. They're already saying 9 in 10 of them are saying workforce pressures cause them to be worried about the safety of the service they provide. If GPs are forced to work on Saturdays and Sundays from 8 a.m. till 8 p.m. as well, the weekday service will be thinner and it'll make it even more difficult. If the government wants a 7-day service, fine, they have to resource it. And at the moment, there's no way they can afford it on the money that they're prepared to put for the NHS. Campaigning works. As we've shown, Lewisham Hospital, they've shown campaigning works. So I think those of us who care about the NHS have to continue to build a movement to underpin anything that happens in Parliament, in government. We can't, you know, we have to keep working really, really hard all the time, just so that they can't walk away.